Hey everyone, and welcome. If you've ever thought about what to do with a missing tooth, well, you are in exactly the right place. Today, we're going to dive into the different options, the hidden challenges, and what dentistry now calls the absolute gold standard for replacement. So let's get into it.
So, let's kick things off with a question that seems pretty simple on the surface. What really happens when you lose a tooth? The obvious answer is you get a gap in your smile, right? But believe me, the story goes so much deeper than that.
That's because we're talking about more than just a missing tooth here. The official term for it is edentulism, and it's a problem that goes way beyond what you just see in the mirror.
Of course, a missing tooth affects how you chew and how your smile looks. That's the function and the aesthetics. But the biggest challenge, the thing we really need to focus on, is what's happening completely out of sight, right underneath the gums.
For a long time, there have been a couple of standard ways to deal with a missing tooth. So let's take a quick look at what we'd call the conventional fixes.
And right away, you can see it's a classic trade-off. On one side, you've got removable dentures. They're quick, they don't cost as much, and there's no surgery. But they can be unstable, and your chewing power just isn't the same. Then on the other side, you have fixed bridges. They're much more secure for sure. But here's the kicker. To place a bridge, you have to grind down the perfectly healthy teeth on either side of the gap to use them as anchors.
But here's the most important point. The one thing that connects all of these old-school methods. They share one massive limitation. They're all just surface-level solutions. They fill the gap you can see, but they do absolutely nothing to stop the real problem happening underneath, bone loss. And that, right there, is the real game changer.
And this brings us right to the heart of the matter, the jawbone's hidden problem. It's a natural process that your body starts the second that a tooth is gone.
The process is called bone resorption. And the easiest way to think about it is like this. Your jawbone is a lot like a muscle. If you stop working out a muscle, it starts to get smaller, right? It atrophies. Well, your jawbone does the exact same thing. Without a tooth root there to give it a job to do, it just starts to shrink and melt away.
And you can see the difference so clearly here. A natural tooth root is constantly stimulating the bone when you chew. It's sending a signal that says, hey, we need ya, stay strong. But when that root disappears, the signal stops, and the bone just begins that shrinking process.
Now, why is this such a big deal? Because that bone isn't just there to hold your teeth. It's the literal scaffolding that supports your lower face. As that bone disappears, your facial structure can actually change. It can lead to that sunken-in look that can make someone appear older than they are.
Okay, so this brings us to the solution. The one that was designed to tackle this hidden problem head-on. This is what experts everywhere now call the modern gold standard.
And look, this isn't just an opinion, it's the professional consensus. The source material is very clear about this, saying that dental implants are the standard now because they last for a very long time, they work incredibly well, and, patients are just way happier with them.
So how does it work? Well, the concept is actually brilliantly simple. First, a small titanium implant is placed in the jawbone, and it basically acts as a new artificial tooth root. Second, just like a real root, it transmits all the forces from chewing down into the bone. And third, and this is the magic, that stimulation tells the body to stop resorption. The bone loss just stops. It solves the problem right at the source. And the benefits that come from this are just huge. You preserve your bone and your facial structure. The success rate for these things is incredibly high. Your chewing feels totally natural again. And, this is a big one, you don't have to damage any of your healthy neighboring teeth to get it done, which is one of the biggest downsides of a bridge.
Okay, but let's be realistic. As amazing as implants are, they aren't the perfect solution for absolutely every person in every situation. So that leads to the big question. Is an implant the right choice for you?
We have to look at the other side of the coin. What are some of the reasons why an implant might not be the best option?
Well, there are a few potential hurdles. Certain medical issues, like uncontrolled diabetes, can make healing tricky. Sometimes, if a tooth has been gone for years and a lot of that bone resorption has already happened, there might not be enough bone left to place an implant securely. And then there are the practical things. They do have a higher upfront cost, and you absolutely have to be committed to keeping them clean with great oral hygiene.
So, when you boil it all down, here's the key takeaway. The whole goal of modern tooth replacement isn't just about filling a gap in your smile anymore. It's about something much bigger. It's about preserving the entire foundation, the very bone that supports your teeth and face.
And that really leaves us with one final thought. When you're thinking about your options, the question to ask yourself isn't just, how do I fill this space? The real question is,
Am I just replacing a tooth, or am I investing in restoring the entire system for the long haul? It's a total shift in perspective, and it makes all the difference.